All right, so the vertebral column, we're going to see that it's formed by 26 bones in adult, and it also transmits weight of trunk to the lower limbs. It surrounds and protects the spinal cord, and this is the vertebral column. So a lot of this is because it's attached with a lot of the muscles of the neck and back, but generally the stability of your vertebral column is due to these ligaments that are attached to its structure. Some of the most common ligaments there is called the anterior and posterior longitudinal ligaments. So this is going to be the anterior longitudinal ligament here, and this is going to be the posterior longitudinal ligament located here. And then there's another one called the ligamentum flavum, is the one that you see that connects different vertebrae together from the area of the back of the vertebrae. So those are the ligaments that makes our vertebral column stable. And if you take a look at the vertebral column, to see that they don't usually do a lot of movement, because remember, nerves passes through this hole, and the nerves that comes from the spinal cord passes through the hole is called the spinal nerve. And you don't want to impinge those nerves when you have movement of your vertebral column. So generally, the movement is movement of the hip, joint, pelvic bone, and the femur. So that's how you do the movement. So generally, there's stability on the vertebral column, so this doesn't allow a lot of the movement. As I said, it has the spinal nerves exiting through the hole, and that is called the intervertebral foramen. So let's take a look at the different parts of the vertebral column. There's one that's located in the neck, that is called cervical vertebrae. And if you notice the curvature of the neck, so if you take a look at the curvature of the neck, this is concave from the back. There's about 7 of those vertebrae. And then next is going to be the thoracic vertebrae. There's 12, because the ribs also have 12. The curvature for that vertebral column is going to be convex from the back. And the lower part of the vertebral column is going to be your lumbar vertebrae. And curvature for that is going to be concave from the back. And the last 2 of those vertebrae is going to be the sacral and the coccyx. Sacral is actually made out of 5 fused vertebrae. So they have 5 fused vertebrae. They're the one that connects through the pelvic bone to the side. That's going to be the sacral vertebrae. And the curvature together with the coccyx of the sacrum and the coccyx is actually convex. Now, if we take a look at your intervertebral disc. So intervertebral disc is the disc that is in between the vertebrae. So if you take a look at that disc, it's like a cushion-like pad that protects the 2 vertebrae from mashing against each other. And this is made out of fibrocartilage. Talk about that when we study the tissues. And it composes about 25% of the height of the vertebral column. So your height is actually added by 25% because of the intervertebral disc. What are the structures located in intervertebral disc? If I do a cross-section of the intervertebral disc, I can actually see 2 components. The one in the middle is called your nucleus pulposus, and the one at the edge is called annulus fibrosus. So now, again, let's take a look at the structures that we actually see on our vertebral column. So we got the 2 ligaments called the anterior longitudinal ligament, the posterior longitudinal ligament, and the back is going to be the ligamentum flavum. Now, if you take a look at the structures of the fibrocartilage, we have the annulus fibrosus that covers the nucleus pulposus inside. So this is now part of your intervertebral disc, and that's actually made of fibrocartilage. So that is the reason why our vertebral columns are actually stable, because of those ligaments and those intervertebral discs. Now, this is going to be the picture of a typical vertebrae. So if we study the different parts of the vertebrae, we going to use the thoracic vertebrae as a template. So all the things that you see here are things that you would see on the different parts of the vertebral column. So the first one is the projections. So take a look at the projections to the side of the vertebrae. Those projections are what we call the transverse process. So that's actually the transverse process, and then the one that protrudes to the back posteriorly, that's going to be the projection called the spinous process. And then anteriorly for that is actually the body, or what we call the centrum. So we maintain our central gravity based on the location of the body or the centrum. Part of the vertebrae is called the pedicle. So this is the pedicle. That is going to be the pedicle. And on the side is going to be what we call the lamina. So these are your laminas. Okay, and then the arch is going to be the area that here that's very stable. Okay, and that's going to be called the vertebral arch. And the hole that you see in between them, vertebral foramen, and that's where the spinal cord passes through. Remember the other foramen that we mentioned before, that was called the intervertebral foramen. Remember, this is the foramen between two vertebrae. So the hole between the two vertebrae is the intervertebral foramen, in which spinal nerves exit through this foramen. Okay, that's different from the vertebral foramen. So you see the structure that you see on this animation. You can see that the spinous process is projected downward, and the transverse process is actually projected laterally. All right, so when we study all of the vertebrae, we're going to use the typical vertebrae. But remember, other vertebrae has some unique features that you don't see on this typical vertebrae, and we'll see that and differentiate them later on. So this is the cervical vertebrae. Remember, there's 7 of them. Now, C3 to C7, they're typical cervical vertebrae. The C1 and C2 is actually atypical because they have special architecture. C1 is called the atlas. That's the one that articulates with the skull. And C2 means axis. That's the one that articulates with the atlas. And then the C3 to 7 are typical cervical vertebrae, and we'll actually describe them as the body is wider laterally, and the spinous process are short and bifid. So except for C7. Bifid means it looks like the tongue of a snake. We'll see that later on how it looks like on the spinous process. And the vertebral foramen at this point is large and triangular. And that's how you differentiate from the other vertebrae. Now, transverse process is unique because it contains a hole onto the transverse process. We call it transverse foramina. And you'll see that the reason why I have a transverse foramina because a blood vessel passes through the transverse foramina. That blood vessel is going to be called the vertebral artery. We'll see that also when we study the blood vessels. And then you have facets that articulates between the vertebrae. We call it superior articular facets. They face superior-posteriorly on those facets, and this is actually what those facets are. So the facets are the one that articulates with each of the vertebrae superiorly, right? And then the C1 to 7, smallest and lightest of the vertebrae, and C3 to 7 are typical. And if you notice, the body is wider. The body of the centrum is wider, and then the spinous process or bifid. It looks like it has the tongue of a snake. So that's actually the description of the bifid spinous process. And remember, C7 is different because C7 actually has spinous process that is actually similar to the thoracic vertebrae. That's the difference between the 7 cervical vertebrae, and the vertebral foramen are large and triangular. And the transverse process, so you notice it goes laterally, has a transverse foramina. And you'll see that it passes the vertebral artery, and the facets are located here on top of that superior view. And then this is the 7 cervical vertebrae, and C1 is the one called the atlas, and C2 is called the axis. And C7 is known to be your vertebral prominence. Okay, so if you tilt your head and you can feel the bump at the back of the head, you can feel that protrusion. That is called C7. So that's going to be a landmark to identify what is the vertebrae that you actually are identifying when you go and touch over the skin. So the protrusion at the back of the neck, that's going to be the C7, we call it the vertebra prominence. So this is what it looks like on your 7 cervical vertebrae. And C1 is called the atlas. If you notice, the atlas is the one that cradles the occipital bone of the skull. So they're the one that articulates with each other, and this is what we call the atlas. Now, the atlas lacks a body, It lacks a spinous process, so they don't look similar to the other vertebrae. And the main important use is for support the skull, and they actually articulate with the occipital condyles of the skull. And that's the one that allows you to flex and extend the neck. So flexion and extension of the neck, such as nodding yes, that is between the atlas and the occipital bone, and call that the atlanto-occipital joint. So that's how you say yes. You nod your head, and that's between the first cervical vertebrae called the atlas and the occipital condyle of the occipital bone. And then the atlas picture, okay, as I said, it lacks a body, so you don't have a body here. And it is, the spinous process also is missing, but we just call it the posterior tubercle. So there's a simple projection at the back of the tubercle. It doesn't have the spinous process exactly compared to the other cervical vertebrae. And again, it also has transverse foramina to the side. And those transverse foramina is actually similar to the transverse foramina of the 7 cervical vertebrae. Now, this is what it looks like on the superior view. This is actually called the lateral masses. This is the one that will articulate with the occipital condyle of the occipital bone. So this is your skull, and your skull has occipital bone, and that part that is a projection underneath the occipital bone is called the occipital condyle. So that's the one that's being cradled by the atlas. And that allows you to say yes. That is the occipital condyle and the lateral masses of the atlas. Now, let's go and take a look at the axis now. The axis is C2, the second cervical vertebrae. Now, what's unique with this is it has what we call the dens, or what we call the odontoid process that projects superiorly. So this is C2, okay, that you see here. And you see that thing that protrudes upward, that is called the dens. It's formed from fusion of the body of the atlas with the axis. So the atlas and axis will articulate within that dens, and the movement of that is going to be rotating the head side to side, such as saying no. So when you say no, that is between the atlas and the axis. So the joint that is seen by the movement of saying no, rotating the head side to side, is called the atlanto-axial joint. So that's actually between the atlas and the axis. So the dens, or what we call the odontoid process, is the one that's actually unique by this structure. But it also has the spinous process and has a small body located at the anterior view. That is going to be your axis, C2. So C1 and C2 are unique, has a unique architecture compared to the other vertebrae, and that is the cervical vertebrae that we talked about. Now we're going to go down and take a look at your thoracic vertebrae. Remember, the thoracic vertebrae was the typical vertebrae that we described, and those are the structures that we identified: the spinous process, the transverse process protruding laterally, and then remember the foot of that part here is called the pedicle. The part of the arch here is called the lamina, and this is going to be the vertebral arch. Then you have your facets that are located here, and the facets located in the transverse process in the body. And this facet is where the ribs articulate to the side. Those are called the facets. The facets that you see on top of this vertebrae, that's called the superior articular facet. This is the one that articulates with the vertebrae from the top. That's called the superior articular process and facets. And this is how the ribs articulates with the thoracic vertebrae. So this is posterior, because that's the spinous process. This is anterior, because that's actually your body. All of the thoracic vertebrae articulates with the ribs, and the thoracic vertebrae has a heart-shaped body. So the shape of the body is heart-shaped for thoracic vertebrae, And if you notice that the ribs articulate on two places of the vertebrae. One is on the body, and the other one is on the transverse process. So this is how it looks like on the articulation of the ribs with vertebrae of the thoracic. Now for your thoracic vertebrae, it actually has demifacets. And what is a demifacet? These are your demifacets here. So the demifacets is because the ribs articulate with the half of each vertebrae on subsequent vertebrae. So this rib articulates with the demifacet of T6 and also articulates with the demifacet of T7. So that's the reason why they term it demifacets. Now, T1 has a full facet for the rib, and T10 to T12 only have a single facet. It's only have a single facet. All right, so this now gives you a picture of your thoracic vertebrae. Spinous processes are vertebral inferiorly pointed, okay, so they point inferiorly and posteriorly. The vertebral foramen are actually circular. So the foramen are circular. That's actually where the spinal cord passes through. So that's going to be the vertebral foramen. The transverse processes articulate with tubercles of ribs, as we saw from the last picture. The superior articular facets point posteriorly, and that's the one that actually articulates with other vertebrae. So this is going to be your superior articular facet. The inferior articular facet, that's one that points anteriorly. So the anterior one is the one that you see here. That's your inferior articular process. They point anteriorly. And the superior articular facet, they point posteriorly. So those are the facets that articulate with each subsequent vertebrae. So the main thing about the thoracic vertebrae, it allows rotation, but it actually prevents flexion and extension. So rotation is allowed on the thoracic vertebrae, not as much, but it actually prevents flexion and extension of the thoracic vertebrae. Now, you'll see later on in the lumbar vertebrae, it's the reverse. Okay, you'll see that it does not allow rotation, but it actually allows flexion and extension. So we'll see that on the lumbar vertebrae. So that's your thoracic vertebrae, and this is how the lumbar vertebrae would look like. Okay, one of the unique thing about the lumbar vertebrae, they're bigger, robust, and if you notice that the spinous process is actually a square-looking structure, not pointed. So that's actually one thing that how you identify the different vertebrae if you take a look at this. So that will identify the lumbar vertebrae, and with the spinous process on the lateral view, they're actually square-shaped. All right, so let's describe the lumbar vertebrae, and remember there's 5 of them, and we number that L1 to L5. Those are your lumbar vertebrae. So the bodies are thicker on the lumbar vertebrae. And the transverse processes are thin and tapered. So they're actually thin and tapered on the transverse process. And spinous processes are thick, blunt, and point posteriorly. So they actually look like square. The edges are blunt on the spinous process. And the vertebral foramina is triangular in shape. That's the shape of the vertebral foramina. And you have facets. We have the superior and inferior articular facets. They're the one that articulates with the subsequent vertebrae. So this one will articulate the superior articular process, will articulate with the vertebrae on top of it. And the inferior articular facet will articulate with the vertebrae below it. So this is called the superior articular facet or process. And this is called the inferior articular process right here. Now, as I said, that this allows flexion and extension on that vertebrae, but not as much. And the rotation is the one that's prevented. So that's the difference between the two. So this is the lumbar vertebrae, we call it the lower back. And the next vertebrae is your sacrum. Now, if you take a look at the sacrum, it has sharp edges because remember, they're actually made out of 5 vertebrae that were fused. So the area where the fusion occurs is here called the transverse ridges. So this is where the fusion of vertebrae occurs, and that's called your transverse ridges. Now, this is going to be supposed to be the body of the first cervical vertebrae. Now, onto the side, on the proximal side, it looks like it has wings. So the part that looks like wings there is called alae, which means wings. And then this part here, the anterior part of your sacral vertebrae, this is actually what we call the sacral promontory. So remember, the sacral promontory is the one that projects into the pelvic cavity. And so the holes that you see here is supposed to be the intervertebral foramina. But instead of calling that the intervertebral foramina, we call it an anterior sacral foramina. Now, the holes that you see on the posterior part of the view of that sacrum, we just call the holes the posterior sacral foramina. It's actually the same hole from the anterior and the posterior. So they're connected to each other. Now, the posterior view has a different setup. It has a lot of these sharp corners that you see from the middle and to the side. So the middle part, the one that creates the sharpness there, we call it the median sacral crest. And remember, this used to be the spinous process, all of that vertebrae. But remember, they're fused, so the only thing that you will see is a crest that is located at the posterior part in the median location of the sacrum. Now, the one to the side is also something that's actually sharp, and we call it the lateral sacral crest. And remember, this used to be the transverse processes of the vertebrae. So that's actually what we look like. When we look at the posterior view, they're a little bit sharper on the posterior view compared to the anterior view. They're smoother on the anterior view. Now, again, the structures that you see onto the top portion is going to be this superior articular process. This is the one that articulates with lumbar 5, because lumbar 5 is the vertebrae on top here of the sacrum. That's called L5. So this superior articular process will articulate with the inferior articular process of L5. Now, the part here that's called auricular surface, the reason why they call it an auricular surface because they're the one that will articulate with the pelvic bone. So the pelvic bone is located on each side of the auricular surface. Remember, the sacral vertebrae connects the pelvic bone to the back by the sacrum. So that is the area in which you see there's roughness there. That's going to be called the auricular surface. Okay, and then the last one is going to be the coccyx. Okay, there's about 4 fused vertebrae there. And that's exactly the structures that we need to identify on this sacrum. All right, so sacrum is just one. It has 5. Okay, it shapes the posterior wall of the pelvis. So that's one that connects the 2 pelvic bones to the back. It's made out of 5 fused vertebrae. And the superior surface articulates with L5. So this is the superior articular process. Okay, that's one that will articulate with L5. Inferiorly, the distal part of that sacrum is the one articulating with the coccyx at the bottom. And the center of gravity is 1 centimeter posterior to the sacral promontory. So that's going to be the center of gravity. It's 1 centimeter posterior, 1 centimeter posterior to the sacral promontory. That's actually the center of gravity of your body. Now, the sacral foraminas got holes where passage of the spinal nerves, called the sacrospinal nerves, would happen. And remember, the spinal nerves are coming out from the spinal cord. So we got the ventral foramina and the dorsal foramina. Ventral is actually the one located at the anterior surface of the sacrum. We call it the ventral foramina. And the one located at the dorsal surface or the posterior surface, we call it the dorsal foramina. So those are holes. Okay, they're actually the same hole, except that it's on different position that you would identify. One was anterior, what we call ventral. One was posterior, what we call also dorsal. So the last bone is going to be the coccyx. So we call it the tailbone. It's about 3 to 5 fused vertebrae, and only offers slight support to the pelvic organ. So this is what it looks like on the vertebral column. Okay. So if you want to differentiate the different vertebrae, the cervical vertebrae that has the spinous process is bifid. And the spinous process is thoracic. It's easily identifiable by the sharp spinous process. So that tells you that's your vertebrae. And the lumbar vertebrae is easy identifiable also when you look at it from the spinous process that is blunt. So that's how you differentiate the different vertebrae. So if I ask you to actually differentiate them, you should be able to identify the landmarks. Now, aside from the bifeed on your cervical vertebrae, there's a hole onto the transverse foramen of the cervical vertebrae. So that's called the transverse foramina. Right? So this is how it looks like on the bony thorax now, okay? So what is the bony thorax? It's the framework of the chest. So it's the component of the bony thorax is the thoracic vertebrae from the back and laterally to the ribs, and then the anteriorly is going to be the sternum, and the costal cartilage is actually the structure that you see here that connects the ribs to the sternum. So these are the components of the bony thorax. But remember, the vertebral column is actually that is by itself. The bony thorax is made out of the thoracic vertebrae, the ribs, the sternum, and the costal cartilage. But if you just say the thoracic cage is actually just made out of the ribs and the sternum. So these are the two components of your thoracic cage. All right, so the bony thorax protects the thoracic organs, which is actually going to be the heart and lung. And it supports the shoulder girdle and the upper limbs. So if you notice that the shoulder girdle, which is actually the clavicle and the scapula, they're actually being supported by the bony thorax. Now, there's a lot of attachment sites for the muscles on the bony thorax, so that's very important also. So the sternum is a chest bone. So it looks like an inverted dagger in which this part here is like the handle of the dagger. So we call it the manubrium. And then the body of the dagger, we call it the body. And then the tip of the dagger, we're going to call it the xiphoid process. All right. So this is what a sternum looks like. Okay. If you take a look at the sternum, it has three parts: the manubrium, which is the handle of the dagger, and there's a notch on top of it, and that notch is called the jugular notch. So that's called the jugular notch. Now, the next structure after the manubrium on the inferior bottom is going to be the body. And the body and the manubrium articulates in this area called the angle of Louis, or what we call the sternal angle. So the next bone here is going to be the xiphoid process, and the place where the body and the xiphoid process are articulated, we call it a zippy sternal joint. And also the manubrium articulates with the clavicle to the side. So the clavicle articulates here to the side. Okay, remember the clavicle is part of your pectoral girdle. We talk about the body, there's notches to the side. That's where the articulation of the costal cartilage of the ribs. Remember, the costal cartilage are cartilage that attaches the bone rib into the sternum. So those are called the costal cartilages. And they happen to occur only at ribs 2 to 7. Now, xiphoid process, inferior of the sternum. Remember, this process is cartilage, but once you grow older, like 40, this becomes bone. So it turns to bone. It ossifies at the age of 40. The top portion is jugular notch, okay, and sternal angle is actually called the angle of Louis. And the rib that is that's located to the side of the sternal angle, or the angle of Louis, that rib is rib 2. That's how we identify the different ribs over the skin. So if I feel the angle of Louis, you can actually feel it's actually some kind of bump you feel on your chest bone. And then if you go to the side of it, okay, that is going to be rib 2. Then below that is space 2, rib 3, space 3, rib 4, space 4, and so on. So these are some of the components of the sternum, okay, and now we're going to go to the ribs now. Now, the ribs attach to the vertebral column posteriorly. So 12 ribs attach to the posterior column of the vertebral column. And we divide it into two ribs, ribs 1 to 7, And false ribs is actually ribs 8 to 12. But under the false ribs, ribs 11 and 12, they're actually called floating ribs. The reason why they call it floating ribs is because they didn't connect into the sternum anteriorly. Right, and then what are the structures I need to identify on the ribs? Okay, now remember, there's actually two spots of the ribs that articulates with the vertebrae. One at the demi-facet of the body, okay? That's actually the head of the rib articulating in that area. And then there's another one after the head, it becomes the neck. And then after the neck, you have this part here called the tubercle of the rib. And that's the one that articulates with the transverse process of the vertebrae. And that is where the second articulation of the rib will be located at. Now, this is going to be the part here at the corner. That is going to be the angle of the rib. And then it proceeds anteriorly and connect to a cartilage called costal cartilage. That costal cartilage will be the one that will attach into the sternum. So this is going to be your sternum. So the bone is actually the rib bone. Does not directly connect into the sternum. They attach into a cartilage that is hyaline, and that's called the costal cartilage. Now, if I do a cross section of the rib, this is what it looks like. The top portion is smooth, and the bottom portion is a little bit sharp because it has a depression at the inferior margin called the costal groove. Now, the costal groove is actually where blood vessels passes through. We call it the intercostal veins, nerves, and arteries. So that's where the costal vessels and nerve actually passes underneath the portion of the rib. That's going to be the costal groove, okay? So this is where the depression occurs at the inferior part, not on the superior part, because blood vessels and nerves passes through there. Right, then this is how it looks like on the ribs articulating with the vertebrae. So their articulation is on the body, and there's another one that's going to be at the transverse process. So the tubercle of the rib articulates with the transverse process, and the head of the rib articulates with the body. Now, this is going to be the shaft of the rib, and this part here, the transverse process, you got ligaments that holds it into the transverse process. So at the part of the vertebrae, that facet that articulates to the rib, that is going to be the transverse costal facet, which is where the tubercle of the rib articulates. And this part here is going to be called the superior costal facet, where the head of the ribs articulates.